Hello, my name is Nicola Wilson, and today I'll be doing a lungs and respiratory assessment on my patient here. Um, in normal clinical circumstances, you would do hand hygiene, identify your patient before you would even do your assessment. Since this is not a clinical situation, I will not be doing those things, but that is something to keep in mind. Also, I will explain what I'm doing and why I'm doing certain things, but in a clinical setting, I wouldn't necessarily be doing that all the time unless the patient asks a specific question. With that being said, we'll go ahead and get started with our first. I would visualize my patient. I would assess visually what my patient looks like. What does their breathing effort look like? We're just sitting here, not doing anything. My general appearance of my patient is calm, collected, no real respiratory effort going on whatsoever. Posture is good. There's no tripod position, which would be indicative of respiratory distress. There's no use of intercostal muscles or accessory muscles to help with breathing, which is good as well. Skin color for this patient is a normal skin color. I think in general it is important to keep in mind the natural skin color of a person. If there is an indicator that something is wrong respiratory wise, it would look different depending on that patient. So it is very important to establish a baseline for your patient to be able to know whether there is an issue or not. Next, I will look at my patient's chest wall configuration. We're going to look at the muscle development of this male, and for this male it is appropriate. Women, their muscle development is also going to be different comparatively. Pregnant woman, muscle development is going to be different, may have engorgement of the breasts. Children will obviously be different compared to adults, and then the older population, there may be muscle degeneration or weakness, flabby skin, anything like that. We'll also look at the ratio of the AV to here, and it either needs to be equal or less than. And in his case, it is equal or less than. There's no barrel-shaped chest or anything like that, which shows that there is no long-term issues with respiratory issues. The costal angle will be followed here at the bottom of the sternum and how the ribs flare down. It needs to be a 90-degree angle. If it is greater than 90 degrees, that is also an indicator of long-term respiratory issues. Next, we're going to look at other physical symptoms of current oxygenation and perfusion. We will look at the patient's hands, pink in color. When we squeeze the fingertips, capillary refill is less than 3 seconds. And we want to inspect this with all the fingernails. This is indicators of perfusion. And if we were to note an issue with circulation, then we would notice which of the fingers would have an issue with that. The rate and quality, our patient is breathing at a normal rate with no use of abdominal muscles, accessory muscles. There's no tightening of the shoulders, which could also be an indicator of having difficulty breathing. While sitting here, I cannot hear my patient breathing. I hear no sounds of wheezing or anything like that. When we look for landmarks that are important to the respiratory system, we note the trachea here, and you can feel the trachea. The esophagus would be right behind it. Further below is the clavicular notch. Below the clavicular notch is the manubrium. This is the location of the bifurcation of the trachea, which splits into the two lobes of the lungs. So here and here. Depending on where you put your stethoscope on these spots, you'll hear different types of sounds, whether that is your vesicular breath sounds, your bronchiovesicular sounds, or your bronchial sounds. Vesicular is going to be up higher. Bronchiovesicular is going to be lower, and bronchial will be the lower lobes. Each sound is different depending on how much air you can hear flowing through your patient's respiratory system. So here we'll feel for muscles. I feel no tenderness. Do you feel tenderness?
I do not.
No muscles are contracted. I do not feel any bumps. I cannot see any bruises or lesions. And those are all good indicators. My patient looks symmetrical in terms of the respiratory system. I want you to take a very deep breath. We have symmetrical expansion on the front. Sit forward just a little bit for me. Take a deep breath. By placing your hands on either side of the back and having the patient take a deep breath, if your hands move up together, there is symmetrical movement of the back, therefore symmetrical movement of the whole respiratory system. Now I will actually listen to my patient. Go ahead and take some deep breaths. Everything is clear, equal bilaterally, which is good. I can hear the different types of sounds depending on where on the respiratory system I am, whether it's vesicular, bronchovesicular, or bronchial breath sounds. It is also important to listen to your patient on the posterior side as well. The sounds would correlate accordingly. Go ahead and take some deep breaths. Good job. Furthermore, nurses can also use percussion to determine respiratory status of a patient as well. It is not very commonly used. It's a more of an old school nursing technique. There are other methods like listening to a patient say 99 or blue moon, which can also indicate if there is atelectasis, pneumonia, or anything other types of disease processes. And that is my respiratory assessment of my patient today. Thank you very much.